As we expand capacity further, we're working round the clock to make sure everyone who needs a test can get a test. The vast majority of people who use our testing service get a test that is close to home, and the average distance travelled to a test site is now just 5.8 miles, down from 6.4 miles last week. But the whole House knows that there are operational challenges, and we're working hard to fix them. We've seen a sharp rise in people coming forward for a test, including those who are not eligible. The top priority is, and always has been, acute clinical care. The next priority is social care, where we're now sending over 100,000 tests a day, because we've all seen the risks this virus poses in care homes. We'll set out in full an updated prioritisation, and I do not rule out further steps to make sure our tests are used according to those priorities. On the question, Mr. Speaker, of the moonshot, we haven't had any plans for 10 million tests a day, but we do have a goal to get to the millions of tests a day when we can. It's dependent on new technology, so that's what we need to drive forward, and it is absolutely vital for this country, for the resolution of exactly the problems that we're talking about today, but also to then expand testing availability more widely. The capacity constraint that there is in the labs rather than the centres. We have the centres available to be able to process a huge amount of tests. We have the record capacity in the labs, but it is in the labs that the constraint is. Now we're bringing in more machines. We've got more being installed all of the time. That's why the capacity is constantly going up. But nevertheless, clearly we need to keep driving at that because the demand is going up as well.